Earliest attempt at hip replacement was made in the 1800s. Modern procedures came about in the 1970s. Some 40 years later, technology and procedures continue to push the envelope on treatment. Joining us now is Dr. Jason Weinstein of Boca Raton Regional Hospital to get us up to speed with the state-of-the-art technology. First, what are the different approaches to hip replacement?
So there are several different approaches. The most popular are the posterior approach. And now, especially in Florida, the anterior approach has become fairly popular. These approaches essentially differ, and they're named essentially by where the incision is started. The anterior approach is started on the front of the pelvis, and that has been popularized for the past few years as a newer approach, but in reality, the anterior approach has been used for many decades. The anterior approach is touted as being a better approach by some because they feel that there's a lower dislocation rate. The posterior approach is an approach where the incision is made just a little bit behind the outside of the hip, and that approach has been used very widely. It's the most popular approach to hip replacement in the United States.
Okay, and what are the current hip replacements made of? I see you brought some tools here.
Yeah, so
examples?
these are just models. Essentially, a lot of patients, when you say hip replacement, what does that really mean? Obviously, the hip is essentially a ball and a socket joint, and this is the part that in a traditional hip replacement is inserted into the femur or the thigh bone. And then on the socket side, the damaged cartilage inside the hip is essentially covered with a cup like this. And the articulation between the ball and the socket, the artificial ball and socket, is the new hip.
What about a risk for squeaking? I know that's a concern for some patients.
Yeah, so with advancements in technology, there are new materials, and these are what we call alternative bearing surfaces. The idea is that if we make a better surface for these implants, we can make the implants last longer. People want to be more active. They want implants that are going to stand up to their daily life and last longer than 20, 30 years if possible. Ceramic hips are used by many surgeons, but one of the things that has come to light is that about 9% or so squeak, and that's bothersome because obviously you're making noise as you're walking.
Okay, and really quickly, we're running out of time, but are there different implants used for active patients?
Again, alternative bearing surfaces are used for younger active patients, and that really is a decision that only the surgeon and the patient can make on an individualized basis.
Okay, thanks so much for joining us. Boca Raton Regional Hospital sponsors our expert and underwrites Ask the Doctor.